Ladies and gentlemen, we are in a public health crisis. I'm not talking about mpox. I'm talking about the educational crisis that we are facing in public health. There are so many, maybe not disproportionate, a unfortunate amount of people who are delivering public health information for motivations that are not consistent with what public health is actually for. And that is to make sure that people have access to great care, that they reduce pain and suffering in populations by reducing the prevalence of disease and illness. And I don't think that's the motivation of some of these public health educators anymore. I think it's fame, ego, money, something along those lines to fit in it with a group. It's something different, because I'm going to talk about a person who I think knows better. His name is John Campbell. Many of you may know
Well, a warm welcome to this talk. It's Friday the 16th of August.
Starts off every video like that. He gives updates. He used to do a lot more frequent updates. He did daily updates for COVID-19. He delivered information in a way that was elegant. He's a smart person. I know he is. If you look back at some of his old content, this truly is a person who is knowledgeable about health science. He has a doctorate in nursing, actually. His PhD is in nursing education, if I'm not mistaken. People raff on him for not being a medical doctor and calling himself doctor. You have a PhD. I think you deserve the title of doctor, actually. I don't think that's worthwhile investigating, because I think this man has plenty of health science knowledge, and I think if you look back at his old content, you'll see that he is a very knowledgeable and reasonable person, and I think some different contingencies, some different motivations took hold and changed his topics. A lot of his most popular videos were actually addressing some COVID-19 conspiratorial things, such as ivermectin being a valid treatment for COVID-19, and they were trying to hide and suppress it, and some of the COVID-19 vaccination conspiracy theories and stuff like that. So some different motivations took over, and I know he's not just talking about reasonable things within COVID-19 vaccinations. It is, look, COVID vaccinations had side effects. Any reasonable person would tell you that. Some of those were fatal. Those were confirmed. That was the myocarditis risk. You can talk about those things. That should be totally fine. If you want to misinterpret everything, misinterpret data collected about disease adverse reactions, if you want to misinterpret elevated deaths, excessive deaths, and contribute those to vaccines, you are doing incredible misinformation, and that it is unreasonable. And when we have future public health issues, the blood is on your hands. The blood is on your hands, because you can talk about these things reasonably, and you can give people important information to talk about things. I think it's totally reasonable for someone less than 25 who has already had COVID to question if the COVID vaccination was right for them. I think it's less reasonable if you've not had COVID, because guess what? He never talked about the risk of myocarditis with COVID-19 was higher. He may have talked about it. I don't really know, but this whole stuff with the white blood clots, and you go look at his channel, he's gone far off the deep end. And it's for motivations that I don't think are public health related. I don't think he cares about the health and well-being of the general public, and we're going to see that here in a way he talks about mpox. So let's go ahead and play that. Here we go.
Now, a couple of days ago, last Wednesday, the Director General of the World Health Organization was talking about monkeypox, which they've renamed as mpox, and he announced a public health emergency of international concern, or a fake PHE.
You heard that, a fake public health emergency of international concern. Just I'll keep playing. And we'll get into that.
Now, it's not for me to tell you what to think, so I'm going to give you the evidence for how risky this looks. But if you're dashing off to work and you just want the bottom line, I am concerned about the ongoing morbidity and mortality in Africa. There's been several hundred deaths. That's always bad. Way less than other transmissible diseases, way less than malaria, of course. But still, it's a disease causing problems in the Democratic Republic of Congo, particularly. We have had a case that's just come to Sweden, but that was a traveller from the...
Okay, I'm going to stop there real quick, and we're gonna address this. a few points that he made. I'm going to bring out the chalkboard for this one. Let's see. Okay. Public health emergencies of international concern do not indicate a pandemic. I want to say that for everyone. Public health emergencies for international concern are not tools in order to get people to comply with certain public health measures in order to test control. That's number one. Number two, public health emergencies of international concern do not always indicate a pandemic, but they do indicate a threat, some sort of generally a biological illness, an infectious disease that poses a threat to international healthcare systems. I think that's generally what it refers to. And at the same time, you can have a public health crisis in individual countries sometime, but a disease that is multiplying in a way that is not like it was multiplying before, it's gained access to a population, always has the opportunity to mutate and to basically gain new skills, new modes of transmission, which can impact the international world. Unfortunately, I do believe there is this kind of class idea that things that impact Africa do not have as much of an impact on the Western world. We are very classist in that extent, in that we don't treat or help provide the tools necessary to help countries suffering from those public health issues. And in the same sense, we will basically hog all of the resources, because a public health concern in Africa is a public health concern across the globe. And that's just how it is. As we look at climate change and the impact on the climate, and it makes a lot of the southern United States hotter, we're going to see more cases of malaria. We're going to see more cases of diseases that were just hospitable in Africa, but we're not as hospitable here. And it's just going to do this. And that's because we've avoided those issues. We've not treated those as issues for quite some time. But a public health issue of international concern has never meant generally pandemic potential. Ebola was a public health emergency of international concern, but it was not considered a pandemic potential. And even at the same time as he states that he kind of dog whistles here, and I know that's where he's being facetious. He kind of dog whistles that, am I concerned that it's going to impact you and me? No. That's not what a public health emergency of international concern is. And even the WHO is not saying that this is going to be like COVID. Okay, it doesn't have indicators of being like COVID, but we can move on from that. It does have indicators of impacting populations, of causing morbidity, mortality, that is excess. It does have indicators in that, and all of these people deserve equal access to treatment and care, even if that's populations it does access in the West that we just for social reasons have a proclivity of ignoring, such as the LGBT community, men who have sex with men. The HIV epidemic was one that was a public health emergency that we ignored because we, as in the United States, generally ignored, because that's not everyone, right? I'm not like that. I don't. It's stigma. It's wrong. It's not what public health is. Public health philosophy is reducing illness, disease, and increasing well-being across populations, no matter what that population is. So, what did he say there, though? Let's say we have disease X. I'm not going to compare it to Mpox particularly, because I'm going to work with easier numbers, like a case fatality rate of 10%. That's easier to do in my head than 3%, okay? Let's say we have a random disease X. I think this is actually what was named after the conspiracies before COVID, right? Disease X was I don't know. But that's just a variable. It's a random disease. Make it up, okay? We're playing Plague Incorporated, okay? So, has a CFR of 10%. If it is today, and this outbreak has started just 10 days ago, and if it's infected 500 people and killed 50, is this a problem? Is this a problem? This is less than malaria. This is less than influenza. This is less than COVID. This is less than a lot of things, right? So this is not a big deal, right? When does this become a big deal to you? Because it's not this 500 cases, 50 deaths that makes it a public health emergency of international concern. It's not those, it's the traits. It's the R naught. It is the potential case fatality rate. Okay? It's the ability of this thing in the future to become a problem. So, if you have a disease outbreak, let's say a mpox, for example, and it originally had an R naught of 1, and it was staying endemic to a specific population, but for some reason you went from 300 cases per month to, let's say we went to 1,000. What's the problem here? Over time, this R naught has increased, right? This R naught has increased. Think of that. A person infected with this variant infects less people than a person infected with this variant. So over time, that increase between these monthly populations, 700 people, that is 700 more opportunities a month. A month, bear in mind, not just 700 more opportunities, that is 700 more opportunities a month for a mutation to occur again, which further increases the R naught. Let me go back. Do we know what an R naught is? An R naught is the potential for a disease to... It's how many one person spreads the disease. The flu has about 2. You get the flu, you spread it to 2 people. So if you have one person who gives it to 2, these 2 give it to 2, these 2 give it to 2, and these 4 give it to 4. And what do you see here? Oh, sorry, I'm running out of room. What do you see here? That's 1, 2, 4, 8. What is that? Huh? What is that? It's exponential. It's exponential growth. When you look at it on a graph, it's going to look something like this. So, an illness's potential doesn't just rely on its current R naught, it relies on its future ability to increase its R naught. It relies on that case fatality rate. It relies on its ability to incorporate itself into different populations. Let's look at 2022 mpox. This is a disease whose R naught in non-LGBT community was probably around 1.2 or so. I'm kind of estimating and kind of going off memory. I don't remember for sure. It was around 1.2. This was in predominantly Africa. What did it do? It somehow got a hold of the men who have sex with men community, and because of the behavioral differences and the mechanisms of spread, it has no fault of their own. This is all social. It's nothing they've done wrong. It's different behaviors that cause the R naught to increase to around 2, and of course, because of that, it started getting access to different countries and populations. And guess what? It's not an STD. It's not an STD. Okay? It's not an STD. So when it gained access to those, gained access to different populations, it could spread to different ones. Okay? This was a public health emergency of international concern, even though it had a case fatality rate of around 0.1%, but we know there was clade 1. We know its potential if it had a unfortunate mutation. Right? Right? So, we can't discount mpox We don't just go about and we don't discount it because it impacts certain populations more than others.
I'm worried about ongoing sustained transmission in the West. At the moment, I think the probability of that is remarkably low.
To
the situation that
this is leading official data sources. Concern. Monkeypox virus, just by way of background, is nucleic acid type of virus seen in monkeys, hence the name 1958. First human case 1958. And we know of monkeys, hence the name 1958. First human case varieties. And we know, of course, that viruses evolve, mutate, and are changing as we're
accurate. He might make some statements that are more dog whistly there. I don't know. He does.
24, we're having quite a few cases of mpox or monkeypox. In fact, in July, over 40 cases reported in the month. So this has been ongoing since 2022, albeit at a very low level, virtually entirely in relatively young men of the work operating in the gay community, virtually entirely. In fact, I think entirely so far in the UK. Now, Clade 2.
So in that, what I think he is doing is, again, where he said at the beginning, it's a fake public health emergency of international concern. He's considering a public health emergency of international concern, one that impacts basically a global population on a pandemic scale. And that's not true. That's not accurate. Again, the concerns of public health are to make sure that all populations, no matter kind, have decreased suffering through the decrease of morbidity, mortality through disease. Okay, and just because Clade 2 predominantly impacted the LGBT community, and that Clade 1 is likely to take the same transmission route, that doesn't mean they are not considered in a public health crisis. That's not what that means. That's not what that means. Because this has the same tone as HIV in the United States, where we practically ignored some serious, serious consequences of a rampant disease, infectious disease, HIV, human immunodeficiency virus, that caused tremendous suffering, and we didn't provide resources for the development of treatment, for educational promotion, all of these things. We let misinformation run rampant in such a way that we basically disregarded a population and did not fulfill that ultimate goal of public health, because it wasn't everyone. It impacted a social community that was the outsider group. That's unreasonable. That's unfair, and we do not do that with mpox. We don't do that with mpox. Just plain and simple. And I don't think he's doing that in that sense or for that reason. He's not particularly doing it because of the social class. He's doing it in regards to the COVID conspiracies. They're going to do lockdowns again. They're going to do vaccines again. And he gets into that, and he did it with a lack of research, because here he goes over the transmission. Excuse me.
It's basically the same virus. It just appears to be somewhat more virulent, and certainly skin to skin and sexual contact, of course, mouth to mouth, close, it over. So we get these lesions. Maybe just look at blisters, but the more times that were done on that on this one. Now, vaccines, of course, increased awareness time. And we know from the 2022 outbreak there was behavioural change and increased awareness that did reduce the spread. Now, there is a lot of talk about vaccines on this one. Now, vaccines, of course, have had variable press, shall we say, over the past few years, and we make no...
Variable press on his channel. They don't have variable press. He extrapolates a lot of things out of what isn't that complex, and provides a lot of misinformation on the account of vaccine side effects and things of that nature. He
secret on this channel, we are concerned about the mRNA genetic vaccines and the adenovirus vector vaccines, because we've looked at the adverse events associated with those. When you give an RNA vaccine, you can't really control the dose, because the vaccine can go, well, we know the genetic material goes all around the body. The antigen can be produced anywhere. That can lead to inflammatory effects. And we're generally concerned about that, and we'd like to see a moratorium on RNA vaccines and indeed adenovirus vector vaccines until we know much more about it. But the vaccine for smallpox, monkeypox is not, I repeat, is not a genetic vaccine, at least yet. So it concerns me way less than the RNA, DNA genetic vaccines would. Just to give a little bit of detail on that, the vaccine, there's 3 different ones, but they're all much the same.
My favorite
variety
is saying this, and
in the US at least, it's made using weakened, so attenuated live vaccine virus. This is the CDC. They say it cannot cause smallpox, and I believe them. They say it cannot cause monkeypox, and I believe them. Or any infectious disease, and again, I believe them, unless the sample was contaminated for some reason, but there's no reason why it should be. So it is not a genetic vaccine. It's a traditional antigen vaccine. With the traditional antigen vaccine, you can control the dose very precisely about the amount of antigen that you are getting. The level of immunity generated probably isn't that great. Last paper I read, it was about 66% protection after 2 doses. Only about a 35% protection after 1 dose. But we won't go into details on that because I'm just going from memory from a paper I read yesterday. But
either way, he basically claims that this vaccine is safer, kind of, in regards that it's not an mRNA or adenovirus vaccine. But what's so interesting about that is if you had actually done any sort of research, comparably, the smallpox vaccine is perhaps one of the least safe vaccines that exists. There is a side effect which could be fatal called eczema vaccinatum, I believe is what it's called. I don't see it here. I believe this study kind of goes into detailed accounts of the side effects. And I don't see... Let's see. And it's talking about DNA technologies. I don't know if this one's actually advocating for different types of vaccines and such that it's safer. Yep, smallpox vaccine is less safe than other vaccines routinely used today. Satellite lesions, fusion mustangs, regional, blah blah blah. I don't know if it mentions the eczema. Then again, that is what it is. It was actually discontinued due to the risk-benefit analysis, not
bottles that line your supermarket shelves have labeling that may be
come back to here. Not really having much use in terms of doing more harm due to the lack of prevalence of smallpox. But that risk-benefit analysis may change given the increase in monkeypox, which is in the same class, orthopox viruses. But either way, I'm kind of tired. I just really wanted to introduce the problem here, and I want to do more responses to this guy as he uploads. What I think is really unfortunate is he is incredibly smart. He's not a dumb individual, and I think he's been bought out in a sense. In a way, just as he claims that vaccine companies have bought out. He doesn't say this exactly, but the financial incentive and the hidden motives. They bought out the government, and the COVID wasn't as big of a deal as it was, and that kind of dog whistling. In the same way, I'm gonna argue that he's in fact bought out. He's under motivations that aren't consistent with medicine or healthcare anymore, or he really does believe this stuff, which is unfortunate. But either way, I think it's worse if he's as smart as I think he is, and this is what he's come to. So either way, thank you for watching. I hope you have a good day, and we'll try to respond to some more of this content later. Thank you. Bye.